Grossman, welcome. I see you.
Hi, thank you. Highlight of the summer was going with my family to the coast of southern Maine and having a blast there.
That's great. Sarah Green. Don't see Sarah. Okay. Jay Fati.
Hello, everybody. Just
Jay.
enjoying the sun and family. A good summer.
It's awesome. Ed Escalante.
Hello, everyone.
Welcome.
It's been a wonderful summer. Yesterday, though, I particularly enjoyed going to see the Mariners play. It was a terrific game, and I was there with a lot of friends and had a great time.
That's great. Decker Dirksen.
Here. I just got back from vacation with my sisters and my son, so that was a lot of fun for me.
Nice. Nice. Jimmy Chandler.
Hi, everyone. Well, we've been fortunate to be able to get out and do some hiking across the state this summer and had a great time this last weekend up in the North Cascades. So I'm glad we got to do that.
That's great. And Brad Becker.
Good afternoon, everyone. See a couple common themes. I also did a few yard projects on the honeydew list. I was actually at the Mariner game yesterday, the first one I've gone to this year. Healthcare Financial Management Association had vendors and they sponsored a booth, so got to meet with people. That was a good time. And probably my greatest highlight is I've done this for many, many years, but I spend a week every summer at summer camp. And it's for Seattle Children's Hospital. I've done that for many decades. So went back there again a couple weeks ago.
That's great. Well, thanks and welcome, everyone. I think, did anyone else join? I think all of our members were called. Okay. Great. Our agenda today, you're going to hear a lot of great stuff. So, Amarani, if you can put the deck back up, please, I appreciate it. Next slide is our agenda, I believe. Awesome. So we'll hear from Ingrid first, and then the substance of our meeting, you'll get a market preview of what we know so far about how 2026 is shaping up. We'll talk to you and give you a brief update around Cascade Care Savings. Every year we need to set the state subsidy level where we are on that and welcoming of feedback. And then we'll spend a good amount of time on the response to federal changes. We have many that we have discussed with you all in the past, some of which are now implemented and we're happy to share. And now we need to think maybe a little bit forward. So we'll spend a good bit of that time, share what we learned from the board when we met with them and did that exercise, and hope to hear more from you. So with that, I am going to hand it over to Ingrid.
Thanks, Leah. Let's see, Amarani, you can take the slide down for a second. Let me just say hello to everyone. It's just really great to see your faces, hear your voices, hear about the fun things you've been doing this summer. I guess my summer highlight, as my staff keep hearing about, maybe more than they'd like to, is I graduated from a program called Learn to Row, and I am sculling on a regular basis out here in Vashon Island, loving it. Thanks, Daphne. It's been keeping me mentally, calm and clear in a time that does feel very tumultuous. So it's been a good balance. I'm going to go ahead and I think maybe some rowers are out there. I'm seeing the hearts. Anybody else row? Okay, we can talk about that later. So I'm going to just give a few highlights kind of coming out of that theme on federal change as well, that Leah will cover in more detail later in your meeting, but also reporting back to you on our recent retreat of the Exchange Board of Directors. So Amarani, if you could go ahead to the wave slide, that would be great. Thank you. So just for visualization, think of this as a building up of one big giant wave of harm for our customers that's coming from three different three different levels of federal policy change that you're all very familiar with and have been reading in the paper about. The first lower profile has been the CMS marketplace rule. Some of you have been tracking on that and what it means for state-based exchanges. We did see some good news on that last week due to some legal action. There's now a national injunction, and that rule, which included many provisions, such as a shorter open enrollment period, for example, has been stayed, at least most of the major provisions in that rule. So we are waiting and watching for the outcome in the courts for that wave of change. The second, not at all low profile, the so-called one big beautiful bill, which we just refer to as HR 1. Those changes, we've all had time now to digest and analyze and understand the vast impacts on our Medicaid program, as well as Marketplace. And you'll hear more about over time what that means for us is concerning, and most immediately for the loss of access or eligibility for APTC's advanced premium tax credit for a very large number of lawfully present immigrants in our state, as well as the DACA population. So that's another key area. And then finally, the thing that hasn't landed, that last little bit of the wave, we're watching really closely, which is the enhanced premium tax credit. So reminder that this is scheduled to expire at the end of this year. If I had to make a bet, I would say the safe bet is it will expire, and that is our planning assumption. We know that it's been a huge driver of creating the highest record enrollment ever in marketplaces across the country, and we are bracing for the impact it will have on our customers to pull it back with an average of 65% premium increase on our market. There's been a lot of good conversation happening about this. We've had some recent meetings, roundtables, and press events with members of Congress here in Washington State, including Senator Cantwell, Senator Murray, Representative Larson, just yesterday, Representative Schreier. So I think the members of Congress are becoming well aware of the immediate impact that this one will have come November for increased prices on our market. So I know several organizations, including some of you on this call, will also be visiting the delegation in DC to share our data and information and stories so they really understand the impact for their constituents. So that is what is before us. And then just summarizing, this means fewer people covered, harder to get and stay covered, and higher premiums and overall costs. So this is the wave that we are bracing for. And I would note that one thing I can feel good about in this scenario is things could be much worse for us in 2026. It's not going to be as bad as it nearly could have been due to real innovation, creativity, mitigation effort by state partners through our governor's leadership, our partner agencies, as well as our staff, and just thinking what can we do and how can we blunt this blow? So you're going to hear more about it from Leah, but I really am so grateful to everyone I just mentioned and all of you on this call that here in Washington State, we're going to do our very best to reduce harm from all these change. And the next slide, please. So at the Exchange Board meeting, and Amarani, or here I can do it actually, I'm just going to put in the chat. I want to remind everyone who is on the Exchange Board. So our Board of Directors is recommended by all caucuses in the legislature and appointed by the governor. Current chair is Dr. Monica McLemore. So we met actually in Suquamish tribal lands at the Clearwater Casino there. And I was really grateful to our board for really sitting with us and seeing the moment that we're facing and affirming again that our destination remains the same at the Exchange. Our mission to radically improve the way Washingtonians secure health coverage, and more specifically to reduce the rate of uninsured down to 3%, remains the same. The board affirmed that. They also affirmed and understand and acknowledge the new obstacles that are in our way which are going to cause us to have to reroute and really make this journey to that and that ultimate true north a lot longer. So that's where we're at now in terms of doing that rerouting, doing our planning, mitigating harm, while also preparing that when we're ready, when the moment comes, that we're prepared for a swift and successful rebound. And again, of course, we don't know when in the future that moment will be, but I think the way we get by day to day is knowing that this too shall pass. So next slide. This is a summary of some of the key direction from the Exchange Board, and it's really the what, and now we are heads down with folks, including you, this advisory group, on the how. But these are some important themes in the direction that our board has given us. The first is to continue to hold customers at the center. We had a lot of public comment at our board retreat. We heard a lot directly from customers and those who are close to and serve customers about how hard this time period is going to be. And there's an overall commitment to keep, in all the work we do, keep that viewpoint or that lens of our customer at the center and drive supporting folks who we know will be hardest hit, which right away, very clearly, in our country, as well as supporting all who lose coverage, to think about how they can continue to navigate and access health care, even when they don't have health coverage, working through our partners to do that. The second theme and sort of direction from the Exchange Board is just to keep as many people covered as possible. We know we're going to face losses and predicted very large losses in overall enrollment, but to engage in those strategic mitigation and harm reduction strategies that will blunt that blow, essentially. The third is to simplify the market shelf and find opportunities in this crisis to reduce what we know is a lot of complexity and confusion in this market. We're really putting our mind to that and thinking how at this point in time, how do we do things like ensure there are no bare counties, prevent the worsening of the risk pool, the choice overload, all the risk that we could face. What is the authority that we need to curate our market to ensure that we adapt to the moment and adapt to the big market shifts and stabilize the individual market, so people will continue just to have that basic ability to purchase private health insurance in every corner of our state, and that is essential at this time. The last and final one I'll touch on is stabilizing our business model. So direction from our board is to set the table for new portfolios that are mission-centric, that are maybe potentially some new and different ways that we drive to our mission, and also to diversify our revenue streams. So we know as the ACA marketplace retracts, so will the funding for our organization and our ability to do our business. And so more than ever, we are open and looking at how do we pivot? What can we do? What other things can we do to drive our mission? One that's right in front of us right now that we've been asked to do by the Healthcare Authority and in partnership with DSHS is to support improved customer experience and more efficient financial eligibility processing for what's called the non-MAGI or classic Medicaid population. So that's one example of adaptive leadership, how we're meeting this moment. And again, that's it for my slides. Just want to thank all of you for being on this advisory committee and for being with us today at the very end of August when it's almost Labor Day and you could be out and already relaxing, enjoying summer, but we really appreciate you're with us here today because open enrollment is right around the corner. We need you, and we look forward to working with you more deeply. I'm just looking at the chat in my new window. Is there special reach out to Representatives Newhouse and Baumgartner? Yes, there is. Every single member of Congress is getting a CD or congressional district specific fact sheet, visits, conversations from many different stakeholders. And we have requested meetings with both those two members of Congress and all of our members. We're actually two members of our board, Hiroshi Nakano, as well as John Chapman. So two bipartisan representatives of our board will be joining myself, and Shirley Prasad, our government affairs director, will be going in a week after next to visit with all members, including Congressman Newhouse and Congressman Baumgartner. So thanks for that question, Brad. I don't see any other specific questions, but other info. Yes.
Yeah, I'll just interject. I obviously called those two out because they're the only two in our state in the majority party. So, I mean, not everyone's important, but I felt that with them being in the majority party, that I think supported HR1, that, definitely to know some of those impacts now. Thank you. Yeah.
Absolutely. Thank you, Brad. Any other question or comment? Question for me or comment from anyone else? All right. Back to you, Leah. Thank you.
Thank you, Ingrid. All right, we will take public comment. Amarani, did we receive any written public comment?
We did not receive any written public comment.
Just open it up for anyone in the meeting. I didn't see any members of the public, but if you're here and would like to make one, please let us know. Great. All right, I'm going to turn it over to Kristen Vias, who's going to give us our market preview.
Thanks so much, Leah. Good afternoon. I'm Kristen Vias, Exchange Senior Policy Analyst, and I use she, her pronouns. And I'm going to share some updates on carrier readiness for plan certification, and then also an initial look of our 2026 market. Next slide. So some key things to know about plan year 2026 market. We're going to have 12 health carriers. WellPoint Washington filed to join the exchange as a new health carrier. And you'll see our total number of plans is now at 86. And most of this increase is because of the introduction of a new standard plan, the Cascade Vital Gold. And that was created to support our premium alignment strategy. And based on initial rates, we're seeing both carrier entrances and then also exits. And we'll talk about this a little bit more later, but one watch point is San Juan County. We just have one carrier there and no bronze plans. And then looking at the rates themselves, our market-wide average increase is 21%. And some of this increase, it was intentional and expected because of our premium alignment strategy with silver plans to bring in more tax credit dollars to help offset the loss of that EPTC. And what we have heard from OIC is, of this 21%, 6.4% we attribute to the expiring of the enhanced tax credits. And the last notable change for 2026 is that no carriers filed tobacco rates. So for a carrier's plans to be eligible to receive, so the enrollees in those plans could receive Cascade Care Savings, they couldn't file different rates for tobacco users. And so none of them did. And we're very excited about this because it's important in terms of helping promote equity in health coverage. Next slide. So the plan certification process, it really is a year-long cycle, and it involves collaboration between so many partners of the exchange, including our board, the insurance commissioner, and carriers. And as a reminder, this process initially kicked off for plan year 2026 all the way back in December. So we presented ideas for the 2026 guidance for participation to carriers and the OIC, and then we finalized that back in February. And so this summer, we have been preparing the board for their role in the certification process. And then we also shared with them an update in our August policy committee about carrier progress towards these key certification milestones. We have also been engaging with carriers to identify any planned certification watch points so we can partner and remove barriers. And of course, we are in close coordination with the OIC as we get closer to the certification deadline so we can, respond to any challenges that come up. And as a reminder, September 4th is the carrier deadline for OIC approval so that the carrier can be presented for certification at that September 11th board meeting. Any questions here? All right, great. We can go ahead and move to the next slide. So looking at the 2026 market, some good news. So our premium alignment strategy is working as intended. We saw those silver plan premiums increase, and so we are bringing in more tax credits to help cover some of that gap we know is coming from the enhanced premium tax credits expiring. And then in terms of what plans are going to be offered to customers, so based on initial filings, here's what we know. First of all, a public option won't be in all counties this year. And both Regents Washington and LifeWise are leaving some counties. And we see the impact of this the most in San Juan County. So they only are slated to have one carrier there, which is Coordinated Care. And Coordinated Care is not offering bronze plans in some of the counties they're in, and San Juan is one of them. So what that means for the folks in San Juan is that they don't have any bronze plans to enroll in. So the lowest cost plan available in that county is going to be much more expensive than last year. And some ongoing trends we've seen, carriers continue to discontinue more of their non-standard plans. And we have 4 carriers who are now only offering standard plans. So that is CHPW, Molina, Bridgespan, and WellPoint, our new carrier joining. They all made the choice just to offer standard plans. And even when we see carriers offering non-standard plans still, they have opted to decrease the number of the non-standard plans. And for 2026, what that means, since we've had some big non-standard plans be discontinued this year, is that we're going to have about another 22,000 customers who will be auto-renewed into a standard plan. And then looking ahead to what we're tracking for final rates is we do have a couple of carriers we've heard will have rate increases in their final rates. So those are Coordinated Care and Molina. And then some others are going to have rate decreases when we get their final rates. And these changes are expected. So rates always change during the summer. And the key factor there really are those risk adjustment payments. And so this is a program driven by CMS. And so if you want more information about the risk adjustment payments, that is there included the appendix, but that's what's driving some of these changes from initial to final rates. Next slide. So 2026 is a year of a lot of change, and we've known that the expiration of the enhanced tax credits was coming. And so, us, the exchange and partners have taken a lot of steps to try to mitigate the negative impact this is going to have on customers. And of course, the biggest intervention there is premium alignment. So if we look at the market average, there would have been about a 70% increase in net premiums if we had taken no action. So with premium alignment, we are cutting that market-wide increase now about in half, so only 43%. And so this is just an average. Every customer is going to have a different story. So their experience is going to differ based on their income, what carrier they're in, their age, and of course, metal level. And so overall, premium alignment is going to mean that folks are going to have much lower net premium increases than they otherwise would have had. But it really depends on a lot of different factors, and that's why targeted messaging with customers is so important this year. And so I'm just going to kind of give you a few of those kind of key cut points to show you really what the situation will be for a customer. And so it's easiest to think about it as customers who are over 400% FPL and then those who are under. So starting with the over 400% FPL, they are going to lose eligibility for federal tax credits completely. So they will be seeing that highest premium increase, which is that net 70% we talk about. Then, if we turn to those customers who are under 400% FPL, they're going to continue to be eligible for tax credits, and they will have, like, on average, a 26% net premium increase. And so, as we explained, silver premiums are going to go up to bring in more tax credits. And so what this means is that only those customers who are under 200% FPL may be served by being in a silver plan. So these folks are able to enroll in special versions of a silver plan that have much lower out-of-pocket costs to help them pay for care. And so these are known as the silver variants, and they're part of the ACA. And so really the choice point for these folks who are under 200% FPL is if they want to pay more for their premium to be in this silver variant that offers coverage that's like a platinum plan. Or if they're a lower, utilizer of care, the gold plan with a lower premium might be a better choice for them. And then if we look at our customers who are over 200% FPL, they should not enroll in a silver plan. If they want comprehensive coverage, they'll be better served by enrolling in a gold plan because it will have a lower premium and it will offer them more coverage. And so, Dr. Grossman, we will actually be getting to that in a couple of slides, but those are great questions. And any questions
Kristen, we're
about this?
over a little bit, but we started late, so just giving you
Okay, good to know.
check.
All right, thanks for the heads up, Leah. Okay, and we can go ahead and move to the next slide. Okay, and so this is focusing specifically on those folks who are under 200% FPL, who we said a silver plan may or may not be a good option for them, and kind of what their choice point is. And so the table you're seeing here shows for customers at different ages and incomes what their net premium will be, and the opportunity they have to think about maybe shifting to a gold plan. And so as you see here, it shows that our youngest enrollees may benefit slightly less from premium alignment. So if you look there and you see the 20-year-old who is at that 200% FPL, they will have a higher net premium, but even so, they're still, doing much better than had we not done premium alignment. So it's really up to the customer, in this group to think about how much care do they utilize as to whether or not they should be in a silver or go for our new Cascade Care Vital Gold. Any questions on this? All right, great. Next slide. So to help answer Dr. Grossman's questions, here are some ways we are helping support customers to these changes and to make sure they get into the best plan for their situation. And so what you see on this slide are 3 key strategies to get folks into the highest value, most affordable plans. And so really the first line of defense is our plan mapping. And so we are mapping about 100,000 customers into a different plan for 2026. So this is a process we do every year. And just for context, we mapped about 20,000 customers last year. So we're mapping many more. And so this is where the exchange auto enrolls the customer into a different plan. But of course, they always still have the option to come in and pick something else during open enrollment. And about half of these customers will be folks that we are moving out of a silver plan into that vital gold plan as part of premium alignment. And the next biggest group of folks will be those who we are switching plans because their current plan was either discontinued or the carrier opted to leave the county. So yeah, so that is kind of the first layer of it. And then we have a second kind of layer of assistance to help folks out, and that is with our plan display and shopping tools. We went live with a new consumer decision support tool vendor in June. So we have a plan recommendation tool on Health Plan Finder, which we call Smart Plan Finder. And with our new vendor consumer checkbook, we worked on customizations to what plans are recommended to the customer to make sure that, based on what they're eligible for, we can get them, the best set of plan recommendations in the premium alignment market. Additionally, we are also making some changes to what plans customers see on Health Plan Finder. The most notable one here is that some customers will not see silver plans at all on the shopping page. And the reason for that is these are not a good value at all for some customers, as we talked about, because they will be both a higher premium and offer lower coverage. The other piece too is we added the Cascade Care Vital Gold plan, and the intent really is for that to be that comprehensive coverage option for customers where the silver plan is not a good value. And does that answer your question, Dr. Grossman? Yes, we agree. Consumer Checkbook has been wonderful to work with, and we've really appreciated. They definitely bring policy brains to things, so we're super excited.
So, Kristen, just a few other questions about that process. It
Yeah.
sounds sort of like a airline seat map dilemma where you can you get an upgrade, but if you have a better seat than what your upgrade would offer you, then you can decline the upgrade. But you would never steer someone into a plan with lower benefits and or higher costs. Is that what you're saying?
Exactly. So we don't want to recommend a plan to the customer where it is like the doubly negative, right? Of both a higher premium and then also lower benefits.
And you're passively defaulting them into that, and they have a option to opt out, but you're defaulting them into the perceived more advantageous plan.
Yes, in some cases, yes. So if they're already in a silver plan and it does not make sense anymore for them to be in a silver plan because of what they're eligible for, then we are moving them into that vital gold.
Offered by the same company?
Yes, exactly the same company. So as part of this process, and this is something we do every year, is we maintain like as much consistency as possible for the customer. So same carrier, same network. And in some cases, this could get super detailed, but we also look at things like, what the customer's net premium is going to be. So this is all done in the least disruptive way possible.
Yeah, thank you.
Yeah, great question. All right.
Kristen,
And I
you
have
have more? Where?
one more slide.
Okay.
And then I'm done. Yep.
Okay, if you can wrap it up quickly, that'd be great.
And in addition to these other interventions and strategies, we talked about customer outreach and messaging is so key. And our partnerships with brokers and navigators really matter more than ever. So we've already started doing some outreach. Here's a picture of one of our postcards we've sent. And really, there has been a lot of change. But good news is, in terms of plan certification, at this stage, all the carriers are on track for a timely approval. And we also wanted you all to know that in the unlikely event that enhanced tax credits are extended, the OIC is approving a second set of rates. So if that were to happen, we will have this second set of rates ready and approved, and we are making plans so that we can pivot and respond if this were to happen. Great. Thank you all.
Thanks, Kristen. Really appreciate it. We're turning it over to Laura Kate for Cascade Care Savings update. As she comes online, if you have other questions for Kristen, please put them in the chat or we can follow up afterwards. We want to make sure we're giving you all the information you need while also getting through a couple more important agenda items.
Thanks, Leah. Hi, everybody. I'm Laura Kate Zeichkin. My pronouns are she, her, and I am your Director of Market Competition and Affordability here at the Exchange, providing a pretty brief update today about Cascade Care Savings. We can go to the next slide, Amarani. As a reminder, Cascade Care Savings is our state premium subsidy. So it layers on top of APTC as APTC is available to folks, or it's also available for our customers who are not eligible for federal tax credits as well. And again, this is our state premium subsidy for folks who are below 250% federal poverty level, and those who are enrolled in those Cascade Care Silver and Gold plans. So every year we set the methodology and the amount of subsidy that our customers will be able to receive within the legislatively appropriated budget. And so we're going to be providing an update today about that draft methodology that we've released. And importantly, some of the policy considerations that we are taking into account as we consider Cascade Care Savings, the amount that will be available to folks in 2026 amid all of the changes that are occurring next plan year. Next slide, please. This is just a reminder, and I think that the links were sent to you as well, and I'll drop it in chat as well, on the methodology that's out for public comment. That closes at the end of this week, and we welcome written public comment if your organizations have not already sent it in, thanks to those that have. Next slide, please. We're going to be talking about Cascade Care kind of and the tools that are available within Cascade Care over the next couple agenda items. So just as a quick reminder, Cascade Care is the Exchange's primary affordability initiative, and it really aims to make health insurance accessible and affordable for our customers who are receiving qualified health plans through the Exchange, and we do so with those standard plan designs that provide more affordable healthcare services with low copays, low deductibles, and many services before the deductibles. The other tool is public option, which sets requirements for provider participation as well as provider reimbursement requirements in Washington State for those public option plans. And then the third is the state premium subsidy called Cascade Care Savings. And Cascade Care Savings goals, if we go to the next slide, really is about providing some additional financial assistance for our lower income customers who need who need additional subsidies on their premiums in order to stay enrolled and get enrolled on the exchange. And that becomes even more important as we look to the next couple plan years here. We can actually go to the next slide. As we think about plan year 2026, which is the scope of this conversation today, but also as we look to 2027, we're really thinking about those customers who are going to face increased affordability burdens because EPTC is expiring, because they are potential immigrants who are no longer eligible for federal tax credits, which starts this year, actually continues into 2026, and then really continues into 2027 for both the Medicaid population and for the QHP immigrant population. And then also, as we're just kind of seeing different market movement and risks and increasing premiums that are expected around that. So that's really sort of the environment that we're thinking about overall for the market, but also for those customers who rely on Cascade Care Savings today and will rely on it even more into the future. So that's what I'm going to talk about kind of in my final slide here on the next slide, which is a little bit of the overview of what the exchange is considering when we're thinking about setting the Cascade Care Savings amounts for plan year 2026. As I said, every single year we go through this process in order to determine, based on the budget that the legislature has given us, which we cannot exceed, how much can we provide based on the enrollment that we're expecting. In previous years, the maximum amounts that we've been able to provide, so from 2023 when the program launched through today, we've been able to provide $155 maximum per member per month to our customers who are federally subsidized. And then in the second year of the program, again through today and into the future, we added a second amount for those who are not federally subsidized. And we've been able to maintain since the beginning there $250 maximum per member per month for those customers who are not federally subsidized. As rates go up, as APTC goes down, or EPTC in this case, the state budget that is set for this program cannot go as far. For 2026, the legislature authorized $55 million for the plan year for the Cascade Care Savings budget, which is consistent with previous years that we've had, but the market and the need is not consistent. So it cannot stretch as far. What you can see in this kind of snip here from our actuaries methodology is that when we think about maintaining PMPM, so if we were going to keep that 155 and 250 per member per month amount from 2024 to 2025, that was projected just with rate increases to increase the Cascade Care Savings budget by like $8 million. So that's last year. When we look at the jump here from 2025 to 2026, if we were to be able to maintain those maximum amounts of $155 and $250 for our customers, the jump would be $67 million additional $67 million that we would need in additional funding to maintain those subsidy amounts. So $8 million would have been the projection last year, $67 million this year. So I think that really demonstrates where we're seeing these significant impacts from EPTC expiration and the federal changes that's having on Cascade Care Savings. So we don't have a budget of 120 million something dollars. So we do need to lower the available subsidy amounts this year. And as we think about doing that, we do have competing goals, and there are trade-offs. We've had conversations with you and other groups that advise the exchange about how we really think about targeting Cascade Care Savings and prioritize populations that are facing greater hurdles, and keeping as many people enrolled on the exchange as possible. So as we think about that, we're not only thinking about the trade-offs around, what does an increase or a decrease in the available subsidy amount look like for folks who are federally subsidized and not federally subsidized, but we're also thinking about impacts to customers based on their incomes or their age, or if they're in a mixed Apple Health QHP household. So our Cascade Care Savings customers, even when we think about that federally subsidized group, there's not an equal sort of impact when we think about the changes to the subsidy amount and the changes to their overall premiums. We're also thinking, about how we don't yet have funding appropriated from the legislature for plan year 2027, but we are hopeful and likely planning a request to the legislature for Cascade Care Savings budget in 2027. But we're also thinking about what is this, how do we kind of think about 2026 as kind of a runway into 2027 as well when we're thinking about Cascade Care Savings, because while there's really significant impacts this year and customers who are facing, significant affordability, net premium increases, loss of federal tax credits and more, that becomes even more pronounced in 2027. So we're thinking about that. And then finally, we are thinking about this balance of plan choice, about other market goals and strategies for this year around mitigating harm for our customers. We do want to ensure that our customers are able to enroll in those low gold plans as opposed to choosing bronze plans or uninsurance. So we're thinking about that as we think about what the amounts are, the maximum amounts are going to be for 2026. I'm going to stop there and see if there are any questions or comments at this point about Cascade Care Savings for 2026.
Well, we're going to come back to Cascade Care Savings in the next section.
Exactly. So, and we can go to the next slide. This just provides kind of an overview of what the next steps are here for setting the amounts of subsidy that'll be available in 2026. As I said, the public comment period closes at the end of this week. We'll be setting the two fixed maximum amounts by September 30th based on final rates. And customers will start to see them in plan preview and as they shop and are enrolled in plans next year. And the other look forward, which gets to Leah's point about kind of thinking about this mid-range of 27 and 28, is that Cascade Care Savings continues to be a really important mitigation for customer affordability and access harms. And so we're really thinking about sort of what that looks like from a potential budget request perspective, and then also a policy perspective. So we'll be working on that with you and other partners in the fall and early next year as well.
Thank you, Laura Kate. That was An amazing summary of a lot of very hard work over this last, well, really quite a few months, maybe 6 months or so, culminating in this. So great. I think I'm going to turn us to the last topic. We've been talking to you a lot about what's come about since we last had our discussion. It seems like there's always a lot right now, but now we'd like to hear from you. So just previewing that this is the participation award place. Laura Kate and I are going to just set up a few slides, and then we have one that, if you haven't had a chance to see it yet, we'll dive into and spend most of our time. It's meant to prompt the discussion that we're going to have. So next slide, please. And one more. I'm going to kind of move us through these so we can get to that discussion. Thank you so much. Okay, you've heard about this already, but just to level set, I think it was Laura Kate that said a little while ago, you know, for us, the 2026 table is fairly set. We know where we're headed. We know, you know, approximations of what our customers are going to experience. I think I would like to just echo the gratitude that Ingrid shared with you and for others, but also for you in helping us to get here. While it's not the place I would want to be, I think our customers are well served by the mitigations that we put in place, and I am really proud of the team and all those partners, including advisory committees like this that helped us with that. So kind of on the right side, you see the proactive mitigation. That includes the premium alignment that you just heard about, means the silver benchmark goes up, which brings more dollars in, and folks can then shift to a different plan that will be lower cost, but can still apply that subsidy too for those that continue to have a subsidy. You just heard from Laura Kate about Cascade Care Savings, and while it will not stretch as far, it is a state subsidy that's available here and not in many other places, and we are being really thoughtful about how to target that. And we also know that the biggest impact, which is overlaps with that on the left side, is to individuals who are going to lose their APTC altogether or their pathway to purchase a QHP if not for the change in our immigrant health program. We now have a program that has been named WA Health Path. WA Health Path is tracked to launch with open enrollment this year. Be a seamless experience for customers that are already on the exchange, but they will have to use a navigator because this program cannot be directly accessed through the exchange. It will need to be accessed through our broker and navigator partners. That is some significant work that really, I think you all should be proud of yourselves to help mitigate some of the losses that we will see and keep people covered. So, you know, that's kind of our 2026 summary, and just wanted to make sure people were grounded there, because where we'd like to spend the rest of the time is really thinking through that 27, 28 time period and what we've heard from our board and what tools we are starting to consider. So with that, I'll turn it over to you, Laura Kate. And next slide, please.
Great. So as Leah said, we're looking forward to some of the changes in 27, 28. If you go to the next slide, you can see kind of the snapshot by year of the federal changes that are coming for our customers. You know, we're really thinking particularly about the market risks that we're expecting as a result of federal changes. We're expecting enrollment losses from unaffordable premiums and eligibility and enrollment changes, making it harder to get and stay covered. We're really looking at potential loss of carriers in certain regions where they're offering plans today and may not offer plans or may not offer all metal levels of plans in the future, leaving some choice gaps for our customers. Kristen talked about that for San Juan County. So we're looking at all of these. We're thinking about not only kind of the strategic implementation with a focus on harm reduction, but we're also really focused on what are the mitigations that can keep Washingtonians covered. And so on slide 3, Ingrid previewed this at a pretty high level, but what we heard from our board, if we go to the next slide, Amarani, what we heard from our board at their retreat is that they are looking for the authority to curate the market, to address market inadequacies and be very responsive and nimble to changing federal requirements that present market risks and customer harms. They've been really clear at that retreat at their direction about clearly defining what risks and potential market failures we need to address and the specific authorities that are needed to address them. And they prioritized for us some priority areas or some principles. In particular, around premium affordability and protecting that second lowest cost silver plan that sets that benchmark for APTC coming into our market. They're really interested in making sure that we're prioritizing and addressing and maintaining for our customers access to coverage. So making sure we don't have any bare counties, making sure there are adequate metal level choices. And then also making sure, aligned with some of our standard plan direction, that high value healthcare services are available. And then they've really asked us to consider how we simplify not only kind of our market, but really thinking about how we simplify the shelf for our customers, particularly amid a lot of the changes that are going to just make the enrollment process and the choice process increasingly hard for our customers. And then, of course, it's always our commitment and our board's commitment to leverage the authority that we have today. And you saw that in the previous presentations and some of the mitigations that we already have in place for 2026. And this is really important too, because today, when we think about board authority, particularly certification authority, we're relatively limited. And I think there's sort of an overview on the next slide. We have quite a bit of authority when it comes to quality, when it comes to some of the Cascade Care criteria that we were able to add when the legislature passed Cascade Care in 2019, which is really sort of our entrance into more of the exchange board's role as a market steward. We also, as Kristen already outlined, have quite a bit of criteria and requirements for our carriers around the shopping experience and administrative criteria. But what we don't have is what the exchange board doesn't have is really any say in what kind of plans can be offered on the exchange beyond the standard plans, what plans can't be offered, bronze requirements, for example, outside of public option, and then also like premium factors or county coverage. So that's something that we're thinking about and exploring on the next slide, which is where we're going to dig in and have some conversation. So just as an orientation to what you're seeing here, we've included here sort of a targeted list of options. This isn't necessarily intended to be all-inclusive of opportunities for the exchange and exchange board to potentially address some market risks. You can see that we've categorized some of the market risks around unaffordable. Bexar County, skimpy coverage, complicated enrollment and eligibility processes. And then there are some options here that we've shared with our exchange policy committee, and that really come in many cases from conversations we've had with all of you. We hope that this is reflective of conversations we've had not only earlier this year, but really across the years here. And then a little bit more orientation to this is that where you see a plus sign, that means that there's some progress in Washington with some potential opportunities to advance. Where you just see the no plus sign circle, there's not progress in Washington yet. So it could be a potential new opportunity. And where you see an asterisk, we're noting where something in particular may require some additional authority. So that's the overview here. I would say that these areas really fall into a few different categories. One is just straight up active purchasing. We've all talked about sort of what California and other active purchaser markets do. And so we're looking at that as options. There's sort of a second category here around sort of meaningful difference or consumer protection standards as part of potential plan certification criteria that would be included in guidance for participation or otherwise. And then there's sort of a third category here that really zeroes in on that continued sort of sharpening of Cascade Care tools, subsidy, standard plans, and public option, including reference pricing and other provider levers. So that's the overview. When we open it up for conversation here, I think we'll maybe attempt to facilitate this by going maybe like one row, like row by row here, or excuse me, like market risk by market risk. And really what we're interested in hearing from you is where your highest interest or priority might be, and then also where you see trade-offs. So that's what we're really interested in. I don't know if we want to keep this up or take it down, Leah. I'll leave it to you, and maybe we can decide.
I put this slide in chat so people could
great.
pop it out if they want. I mean, it's too tiny to see in the chat, but it can pop out. So maybe we take it down and see how that works if because it's better to have a conversation when you can see each other. But if it's difficult, we can pop it back up.
I think that sounds like a great plan. So
Okay.
folks can navigate to chat and open it up. That would be great. And then if you need it back, let us know. We want this conversation to work for you and get that really valuable feedback from you. But maybe starting with that lever or that potential market risk and opportunity of premium affordability. We are looking at both sort of what does it look like from a premium affordability perspective to manage gross premiums on the exchange. So really thinking about some of our broader, meaningfully lower premium goals that we've had for quite some time now, but also how are we really managing the subsidies that are available to our customers to lower their premiums and to have a affordable net premium. And you can see some of those opportunities here. And when we think about maybe in that latter point of premium affordability and how are we maximizing subsidies, one of the harms that we've already talked about in 2026, and as it gets worse as we look to 2027, that Cascade Care Savings just cannot stretch as far. And so really thinking about what are the mechanisms to maximize public subsidy funding is again one of these opportunities among many. So interested in your thoughts. What might be your highest interests and priorities when we're thinking about these opportunities and keeping premiums affordable? What do you see as trade-offs or risks?
I'll start with the active purchasing piece because I think that's an area where when you look at gross premiums versus net premiums, I think there's a trade-off to be made there. And if we're looking at controlling gross premiums for the larger market, it does compromise our ability to lower net premiums for a lot of individuals on the marketplace if you're wanting to maximize what we're doing with the benchmark plan in that space. And, I think we're doing a lot of that with the sober loading right now. But the ability to continue refining that in the marketplace, I think there's a difficult balance to be made what we do to the entire marketplace and what happens to gross premiums if we are trying to impact net premiums for the people least able to afford premiums in the marketplace.
Thanks. Bill, go ahead.
Sorry, I don't have video today. I just think that as your experience with premium alignment this year has illustrated, we really have to think about the impact of policy on net premiums to consumers. And those policies can have pretty dramatic effects. And so one thing that we would urge your consideration of is focusing the Cascade Care Select product to say one per region or something, so that if you did that, it would still be an option to people who want that coverage, but it wouldn't have the effect that it does on pulling down the available APTC for everybody else. And that's something that we think is an important consideration and something that's worth focusing on. I think any carriers not being honest if we don't say that selective contracting makes us nervous. Of course, we'd rather just have automatic access to the market, but it's a concept that we have supported in a number of our states and would probably be prepared to support in Washington State. The marketplace is a major purchaser, and any other major, Boeing gets to decide who they want in there to offer, and so should the marketplace really, and it forces all of us to bring value, and I think it has the potential to be a healthy force. I don't know that it's going to succeed in ways that people might think to, sort of dramatically lower premiums. But in terms of driving market changes and improving quality, imposing standards on plans to improve their game on quality, that's one area where I'll just use, you mentioned California, which does have an active purchasing model. And that's one place where the state has had some real success is in starting to push up the quality scores of carriers. And so that's something that I think is worth considering.
Thanks, Bill. Those are helpful comments. Brad, I see your hand. And then David, I see you putting things in chat, which I welcome you to keep doing. And we can hear from you verbally as well, if that's helpful. Brad, go ahead.
Yes, just to kind of feed off what Bill was just saying. Again, there's not one magic bullet. It's, lots and lots, dozens of different things. But even just picking up what he had different reasoning for it, but maybe limiting the Cascade Care options in regions. Again, I just think about some of our small rural hospitals that have multiple Cascade Care options and maybe just a few dozen people spread over them. And I think it's a theme that I've shared the last year or so on this group. But from the provider perspective, when there's so many different options, so many different sets of rules, then you try to start to do some sort of population management. You have everyone so dispersed under so many different programs, and you're either not successful, or again, the administrative cost, it's incremental, but what it adds when there's so many different components. So having it consolidated would maybe allow us to, are there things and programs that we can focus on in this population that then we're not having to have so many variables? So I think Bill's thoughts, he was looking at that with a premium perspective, perhaps. I'm looking at it from just a cost management perspective, and providers, particularly hospitals and clinics, able to better manage those populations.
Yeah, Brad, that's really helpful. I think we think about sort of like the overload for customers when we think about 12 plans being in a region, but I think that's a really important balance to think about the provider impact as well and what that does for quality and cost.
But you bring up another good point that I'm thinking too, with so many options, are people picking the best plan and not really. When I think about us going through the presentation that's gone on today, and we're people that are in this industry constantly, and I'll even admit, for me, there's some components I'm trying to remember some of the structural things and the difference between this plan and that, and standard and non-standard and all this, and it's next to impossible, I think, for the general public. So did you then select a plan that wasn't best for you? Because not only the premium, but then your out of pocket is way different. So yes, it just makes it so complex. Thank you. I'll be quiet now.
No, thank you. That choice error is something that we watch and measure quite a bit on the exchange. Yeah. I see David's comment around sort of just thinking about, is there sort of a bare bones or lowest premium sort of plan and maybe lowest benefit plan option, just when we think about keeping people covered. And I know that that's something that's, just being explored and something that we're kind of thinking about in plan design to a degree as well. Any other thoughts about priorities, risks, trade-offs, impact when we think about some of the affordability levers? All right. I think we at least want to try to get through one other one, either around mitigating bare counties or helping customers through complicated enrollment and eligibility. And Leah, I'm just curious if you want to lead us through that.
Sure. Let's, where's the interest of the group? Do you have one of those topics that you're more pulled to?
Remind us our choices, bare counties, and what was the other one?
Helping customers through complicated enrollment and eligibility process.
Okay.
Maybe that one. Because we're kind of.
We should always do that.
Yeah. We were just touching on that. Yeah, we all need help. Yeah.
Yeah. Okay. That's great. So I think a couple of things around this one. Do you all have access in the chat? Can you pull that out, or do you want us to put the slide back up briefly? Maybe Amarani, if you could just pop that slide up briefly, we'll spend a minute or so with it up and then take it down so we can talk again. So thinking through kind of problems we're trying to solve here, for this year, you heard about our premium alignment and moving folks to low gold and helping people to understand why, even though we generally speak for the past decade about like silver being that good medium Goldilocks option for people to kind of default to, and then they can best choose based on, their healthcare utilization and other preferences. And now we want them to default to the Goldilocks being the low gold. We do have some tools, and we talked about the ones that we're using this year. But as we continue to see that in the marketplace, we anticipate that those types of shifts will require us to be able, to need to be able to differentiate for customers. Where should you start? And then there are options for you, and the, the kind of the vast majority or the average person option might not be yours, but what is that? So you can see some examples here of things that we already do, and you can see some ones that we don't. And again, just looking for, areas of interest or prioritization or trade-offs that you see with things like enhanced curation of the plan shelf. What people see in Health Plan Finder is powerful. We all know that, depending on the way we shop, whether that be Amazon or anything else. We do have some facilitation and ability to facilitate enrollment. That could be another one where we continue to lean in there about when people are new, where they're going. It's the lowest barrier. You see others that are helping people to, default to the average best choice around targeting state subsidies, eliminating non-standard plans, or creating some standard, even if we have non-standard plans, that really makes the difference very meaningful so that they know what they're choosing. And go ahead and pop the slide down, and we just spend our last 5 minutes chewing on that.
So, from our perspective, moving further toward plan standardization, or at least requiring meaningful difference, is really the opportunity. It's just, we tend to see that trivial differences among plan designs are all around cost sharing, really, sometimes network. It's just confusing. I think it detracts from price competition and focus on quality, which is what we really ought to be. We really ought to be competing around that, around best price, best access, best quality experience, and these little itty bitty differences between Plan A and Plan B just confuse people, and I don't think they really materially help competition in any way.
Others, maybe folks we haven't heard from quite yet.
Sorry, I'll shut up.
Oh, no. That wasn't a dig, Bill. I just wanted to make sure other folks can also get in. Shreya or Ethan or David, maybe. Nope. Okay.
Yeah, Leah, I think I agree with Bill. I think that it seems to me that there's been a movement towards reducing the complexity of the offerings, and certainly I think that we have to limit our expectations about how much literacy people can have in terms of being able to decipher between many plans. I mean, for most of us, I think we'd be hard pressed to actually sit down and create a spreadsheet and understand, exactly what all these mean and what their actuarial value really is. So I support what Bill's comments are about really eliminating the standard plans and also starting to put greater focus on the value that's getting. So when dollars are limited and we want to increase the value of what we're getting, we have to be looking at what the quality of the outcome is. Thanks.
Thanks. I see David. Yep, you also shaking your head.
I don't want to put Vicky on the spot, but I'm going to lightly do so. I know that Vicky, you're always great at bringing in sort of alignment with other work that's going on in the state, particularly your chairing of the Universal Healthcare Commission. So just curious if there's anything that stands out to you from an impact and an opportunity perspective or priority perspective.
Yeah, thanks, Laura Kate. I've just been thinking about all the work that's going on with the Universal Healthcare Commission and the Healthcare Transparency Board and all of that. And I don't see any of that kind of feeding into here. You know, we had the actuarial analysis from Milliman, and we used Cascade Care Plan as one of the plans of thinking about universal health care. I think we're in the perfect storm of really bad things happening that can help us move towards universal health care. I've really, this, by the way, this is my opinion. I'm not speaking on behalf of the Universal Health Commission because each commissioner has their own opinion, right? But I've been talking to the governor's office saying, if we get to universal health care, it's $3 billion savings a year, according to the report that was done with the work group. So that was pre-COVID. So it's probably a different number. I think it's a bigger number. And then we have this impending loss of coverage for hundreds of thousands of people. So this is going to be very unpopular, what I'm about to say, but we're like investing too much energy into making everything work for the insurance companies and not making it work for people and providers. And, that's my big fear. I would like to see, and you're going to see an effort to do some really big transitional solutions from us. Our next meeting is September 11th. And one of the things I'm thinking, and it's crazy, I know, but remember SHOP. We need a public option for small businesses and people who are self-employed. And if we're going to do that, let's do like a PEB lookalike plan and have it be on the exchange. And hey, let's just start some self-funded stuff instead of working with insurance companies, because the goal is to move towards universal health care. We got to get there somewhere. So I know that's very different from what the conversation has been about, but those are my thoughts.
I really appreciate that.
Always from left field.
I don't think so. I think it's a broader context, which we need to be keeping in mind. Vicky, I also would say that it's reflective of some of our board feedback to us of centering the customer, which Ingrid also mentioned. And they had some of those same concepts in mind. Is it good for the exchange? Is it good for, and we talk a lot about, varying parties. And of course, I guess maybe I would broaden it slightly to say, all those parties today are important in making the system that we have work and work better. Your point very well taken about maybe it's time for a different system. But they were also very interested in understanding that those might be the most powerful voices in the room, but the ones that we need to center around are the customers. So I think that's actually a great thing to end on, I think. We are right at 2:30, so I want to say thank you so very much. These are the types of conversations we have this time of year as we are thinking about what our market holds and how we can begin to improve it. So more to come. You are always welcome to provide us feedback either in writing or call us up or email us around any of these or other thoughts that you have. They're very welcomed, and we really appreciate those more broad reflections. Oh, thank you so much, Amarani. In closing our meeting, our next meeting is October 16th. So thanks, everyone. Happy end of summer. Hope you get a little bit more of what you love to do. Take care.
Bye.
Okay, thank you. Bye-bye.
Bye-bye.